Okay, I think we're going to move on to questions for Dr. Gorelick. And if anybody wants to drop any questions into the Q&A box, maybe some of these questions will make you think of other questions. You can also ask questions for Nicole and Nancy if you just have parenting questions you want the answers to. Also, we will give them a chance to ask questions if they think of some after the fact. All right, back to you, Dr. Gorelick, if you want to unmute yourself. Since well, the first question was, since inpatient care is managed by hospitalists now and pediatricians may not be familiar with KD management, who should a parent contact if their child shows signs of symptoms such as a fever returning after the first few days after they've been discharged from the hospital?
Well, so I would say that pediatricians should be familiar with Kawasaki disease. Actually, I think that I would say that the person to contact would be your pediatrician. All pediatricians should have seen Kawasaki disease during their residency and should know what to do. And if there is a return of a fever, in the 2 weeks after Kawasaki disease, that child may have recurrent, a refractory Kawasaki disease, basically. In other words, the first dose of the IVIG may not have worked to get rid of it completely, and so that child should go back to the hospital and probably, in most cases, get retreated. So, yes, it's true that Kawasaki disease is treated by hospitalists, but both those hospitalist pediatricians and your general pediatrician at home should know exactly what to do in that scenario. And that we also sort of addressed it in the Kawasaki disease guidelines, so that's something that your general pediatrician would have been able to read as well.
So again, be your own best advocate, know as much information as you can, and go back to your care provider, your pediatrician in most cases.
Right, and the hospitalists do know, they should know what to tell people to look for when they've been discharged. And one of those things to look for is recurrence of fever. And so those anticipatory guidance is usually given, and obviously things fall through the cracks, but the answer is to go back to the hospital, go, touch base immediately with your pediatrician, and both of those folks should know what to do.
Okay, another question is, what are the current recommendations for long-term follow-up for children with no cardiac complications? I know that parents worry that they might overlook something that would be important.
Right. So, those patients who have had no coronary complications at all, and who don't have to see a cardiologist, etc., those patients should consider themselves no different than any other person who's had an acute disease and who has recovered. Theoretically, one could imagine that it's possible that there might be some changes to the blood vessels in a patient who has not had aneurysms, but when those studies have looked at all of those patients over many, many years, there isn't a signal that they are at a higher risk than other patients. So, if you're following as a cardiologist because you've had an aneurysm, then that is because you're known that you have a higher risk. For those patients who have had Kawasaki and don't have any subsequent aneurysms, they should consider themselves to have dodged a bullet and live a normal life.
Great to know. After the acute phase of Kawasaki disease, a child is recovering in general but continues to experience joint pain. At what point do you recommend a referral to a pediatric rheumatologist?
So I think that you can always, ask your pediatrician to refer you to a pediatric rheumatologist if the child is having joint pain. And so really at any time that you're having joint pain after Kawasaki disease, you might want to see a rheumatologist. But the joint pain that happens after Kawasaki disease is generally transient. It can last up to 3 to 4 weeks, and can be a true arthritis, which means there's swelling of the joint and inflammation of the joint itself. But it is always self-limited. It's not something that persists. And if it does persist, it may mean that there is a different diagnosis And, Kawasaki disease can look like other things. And there are other rheumatologic diseases as well that can sort of look a little bit like Kawasaki disease, but have long-term persistent arthritis afterwards, and that's a different disease. So persistent arthritis means definitely go back and see, your rheumatologist.
One parent wants to know how to stay informed about the latest Kawasaki disease research and developments. Any thoughts on that?
I think that it's always hard to stay in touch with what's going on in the world, especially in this age of disinformation and misinformation. It's hard to know. But I think that, groups like the Vasculitis Foundation, the American College of Rheumatology are good groups that have, publications on their websites and updates. And those are good places to sort of look for information.
Okay, and I just had another question come up that I was asked to ask you. We're not sure everybody knows the difference between acute and chronic. Could you explain how that?
Sorry. So, the difference between acute and chronic is, in general, in medicine, when events happen, they are either sort of self-limited or they take a life of their own and they persist, on their own steam. So things like your common cold, those tend to sort of come and go, or any other kind of event that sort of comes and then resolves by itself, is sort of oftentimes acute. But when you have something that lasts for weeks and weeks, and then persists for months and months and then becomes part of your life, that is a chronic disease. And so that's the difference between something like Kawasaki disease, which tends to be acute and, with the exception of the damage that happens afterwards, self-resolving, and something, say, like ANCA-associated vasculitis, which sticks around because there's some sort of change in the immune system that is basically permanent, and it can be put into remission through use of medication, but it generally requires use of medication to keep it in remission.
Okay, and let's see. Let me just check the next question. What surprised you the most about the study that you did? Has there been new developments or research that uncover causes of scar formation with Kawasaki disease?
So our research was initially looking at how this protein was related to scar formation. And so the surprise was, I guess, that what we thought would be related to scar formation was instead related to inflammation itself, or scar formation, which is different, which is something that happens after inflammation, that the protein is really involved more in the inflammatory process than in the scar forming process itself.
Okay, and I know your process was a result of a Vasculitis Foundation grant. I think I got that correctly. Mm-hmm. What can we do as a society to support research on Kawasaki disease and improve outcomes?
Research, the difficult fact of the matter is that research does require funding. And so all of these organizations that provide funding, and including, the National Institutes of Health, etc., require support in terms of dollars. And that makes, all the difference in the world. But I think that the important thing to also know is that all of science research is feeds into each other. So research in one area can apply to Kawasaki disease, just as research in Kawasaki disease can apply to other areas, say of blood vessel disease or inflammation, things like that. So by supporting research in general, you're supporting Kawasaki.
Always good to point out when we have the opportunity to. It's just like many of the vasculitis situations, is that one thing often does direct progress on another one as well. So we do want to support all the research. I have a couple of questions for Nancy and Nicole. what do you think, either one of you can answer this, what do you think parents can do to help raise awareness of Kawasaki disease in their communities, since you're both involved in raising awareness? Either one of you want to talk?
Okay. One of the things that I recommend to everyone, and many people have asked over the years, is something that is almost cost-free, but every family could do. The American Heart Association sponsors the American Heart Walk at locations throughout the country, generally in the spring, sometimes in the fall. Back in 2003, Jason started a team called Kawasaki Kids. We made up t-shirts on our own. We gave information to his pediatric cardiologist. We made bumper stickers and put them on their cars. I even had some people stop me in parking lots asking, what is Kawasaki disease, when they saw the bumper sticker. When we walked each year in the Heart Walk, we wore our shirts that said, ask me about Kawasaki disease. And so we did raise a modest amount of money, but what we really hoped we were doing was raising awareness. And the more people who have heard of it, should their child ever develop symptoms that could be, they may be more quickly able to seek care for their child within the 10-day time frame for treatment.
Okay, that sounds like a great effort. I understand. I think there's a Kawasaki disease day. Nicole,
Yes.
Nicole, do you want to tell us anything else about that?
January 26th, right, Nancy?
Yes.
So that was dubbed National Kawasaki Disease Day. So we try to spread awareness on our group. I know for us personally, every time we had a chance to do something at the school, within the community, we always push forward, just because honestly, getting the word out is the biggest challenge. The more people that know about it, the less people that are scared of it.
Yeah.
I also, as soon as you get the old jokes about the motorcycles, right? So I just roll with it. Yeah, it's like a motorcycle. Change your oil, just like we got to put the IVIG in and change everything inside to make them better. So if people have to relate it to a motorcycle, so be it.
Okay. Well, I want to I've got two more questions for you guys. I want to make a last call to anybody that's watching to put a question in the Q&A section if you'd like us to ask Dr. Gorelick or Nancy or Nicole. I did want to say that I wanted to ask about the Bridges program through the Kawasaki Disease Foundation. Can either of you address that?
Yes, that's the part of their foundation that I've been part of. It has a director. Her name is Karen Wicker. She's also a parent volunteer and a board member. And basically what it does is their parents can request to become a volunteer. And they ask you some questions about various background and all. There's online training available for the program. And then you are willing to be sent a request from the program director that would ask you to contact a parent who has reached out to them by email or by phone, depending on the parent's preference or the volunteer's preference. And again, very clearly, we don't give medical advice, but we're good at listening. And sometimes being able to tell your story to someone who understands what Kawasaki disease is can be beneficial. And we try to help provide education so that parents can ask better questions of their child's care team.
Wow, that sounds like a great program. I have a question for Dr. Gorelick, and this comes a little bit from conversations with both Nancy and Nicole. Are there any special long-term precautions in children's activities that are needed after Kawasaki disease? They both have said sometimes parents themselves become maybe more protective than they need to be, that their kids are both doing very well.
No, there aren't. I think a child who had Kawasaki disease either not had any problems with the aneurysms or is on appropriate therapy should feel free to be a child and, be active, because that's really the most important thing, keeping your heart healthy, etc. There may be some instances in which people have very, very severe aneurysms and are on certain therapies where a cardiologist might put in place some restrictions. But in general, there should not be, any kind of restriction.
That's really great to hear from a medical expert. I think it's important that the parents know that. Well, at this point, I think I'd like to thank Dr. Gorelick, Nancy Foster, and Nicole Jackson for all that they did to contribute to this great webinar today. We sure hope that this sheds some light on sometimes difficult, even scary situations that families find themselves in after a diagnosis of Kawasaki disease. And of course, thanks to the Vasculitis Foundation for making these educational webinars possible. We do have some additional resources that we think may help out in the future. You can find the Kawasaki Disease Support Group, the one with 8,500 members on Facebook. That's a great group to resource to communicate with other parents. There's also the Kawasaki Disease Foundation website is a great resource. That would be the kdfoundation.org. And also the American College of Rheumatology and Vasculitis Foundation treatment guidelines for Kawasaki disease can be found on the Vasculitis Foundation's website at vasculitisfoundation.org. So thank you to all three of you for giving this great information to the parents dealing with Kawasaki disease. We appreciate your time, and thank you so much.
Thank you, Kathy. And
Thank you for inviting me.
yeah, Ed and Jennifer, you guys, it was great to be a part of it. And Mark, you're very informative. That was awesome. Thank you.